My name is Dominique Carnot, and I'm in the University of Hartford's MSN program. This is a presentation for Nursing 621 Advanced Nursing Practice, and I will be presenting on obesity care and my change project for it based off of the act I chose, Treat and Reduce Obesity Act of 2021. My learning objectives for this presentation will be to define the Treat and Reduce Obesity Act of 2021. I'll identify and explain the change project I created based off of this act. I'll state the need for a change project related to obesity. I'll identify stakeholders and financial implications to this change. I'll explain how to report and evaluate the project change and identify sustainment recommendations to keep this change going forward in the future. The purpose of this presentation is to provide nurses with an overview of the Treat and Reduce Obesity Act of 2021. The goal is to help nurses recognize intervention opportunities for overweight and obese patients. This, paired with enhanced staff education, would provide patients with healthy lifestyle tools to maintain a healthy weight. Enhancing nurses' knowledge on intervention strategies and obesity education skills will improve nurses' delivery of holistic patient care. The Treat and Reduce Obesity Act of 2021 was introduced by Representative Ron Kine of Wisconsin. He introduced this act in the House on March 3rd of 2021. This act identifies obesity as a leading cause of death in the U.S. and it being the second highest cause of death in the U.S. recently. This act identifies obesity as a significant risk factor for multiple different chronic diseases, a risk factor for decreased life expectancy, especially in older adults, 65 plus, and a rise in costs to Medicare beneficiaries, again, people aged about 65 and plus. This is the main difference between this act and the Youth-Specific Obesity Reduction Act. This is more in regards to older adults and has more to do with Medicare reimbursement. So this act does propose to expand Medicare reimbursement coverage for intensive treatment programs associated with obesity education, which will really expand access to care, so that would be great. It proposes expansion of healthcare providers qualified to furnish intensive behavioral therapy programs, such as, the increased use of nurse practitioners, PAs, and registered dietitians. And it proposes the expansion of Medicare Part D coverage for obesity medications, such as benzodiazepines. So I think this act is really important and proposes a lot of great steps to treat and reduce obesity in the U.S. My idea for this change project is fueled by the fact that in my own professional experience, I have cared for a lot of patients who are overweight or obese and really are dissatisfied with their quality of life, their health status, their ability to overall participate in activities of daily living. Data collected from the Treat and Reduce Obesity Act has taken recent data on obesity levels in the U.S. and has projected that if we keep going on the same path, there will be 40% of Medicare beneficiaries aged 65 and older who will be obese by 2030. So this is currently and will become an even more prevalent public health issue going forward. So there really is a need for a change project such as the one I'm proposing. Relevant recent research has identified gaps in patients qualifying for weight loss management but not receiving weight loss advice in primary care settings. So I thought trying to implement more education for nursing staff to then pass on to inpatient hospital setting care would maybe be a different route to try to, close the gap. This change project idea consists of nurse education on access to foods that promote healthy eating patterns to patients, healthy lifestyle counseling on consistent exercise and sleep habits. This education for nurses would give guidance that if a patient's BMI is 25 or greater, that initially on admission, a consult to social work and dietitian should be placed. and same criteria, automatically adding healthy lifestyle written discharge education into the ABS and reviewing it verbally on the time of discharge for the patients who are BMI of 25% or greater would be big initiatives in this project change conceptual idea. Project stakeholders for this change project would be the population that we're serving, so 18 or older, and mostly a focus on older adults, inpatient, hospital setting patients, so males and females, and anyone with a BMI 25% or greater, so overweight or obese. We want stakeholders such as hospital systems because this public health issue of obesity is important to them, and improving overall health status should be important to them as well for, just ethical and financial reasons. Nurses in hospital settings are going to be the biggest proponents of receiving this education from the nurse education departments and then bringing it to their patient population. So they're probably going to be the most important stakeholders. Nurse educators in hospitals are going to be coming up with this education through web modules. Chief executive nursing officers obviously need to approve of this sort of a change project being implemented in the hospital setting. And then social workers and dietitians, they are going to have an increased workload, so we definitely need their buy-in to be able to make this change project a success. As far as achieving stakeholder buy-in, so hospital systems do not get reimbursed if patients get readmitted within 30 days of discharge. So taking these steps to treat and reduce obesity and therefore try to overall improve patients' health status, especially because these patients do have a lot of chronic conditions which do cause them to become readmitted, should interest the hospital systems because it will help them save money on costly readmissions. So it will have a financial benefit. These conditions that obesity is a risk factor for are things such as heart failure, COPD, and acute MI. So kind of like I had mentioned, a lot of these things are things that obesity does contribute to, and really proper education on healthy lifestyle can really help reduce flare-ups and readmission. Care coordination measures and nurse education proposed in this change project can promote healthy lifestyles and reduction in readmissions, and therefore financially benefit hospital systems and really everyone involved in hospital inpatient care. Change project implementation plan. So this plan would include a required web-based educational module for all inpatient nurses in roles with direct patient contact. These web-based modules would be created by nursing education departments and hospitals. It would be a PowerPoint slide web-based module created with basic nursing knowledge that all nurses should know, just might need some reinforcement on, which is the purpose of these educational modules. The cost for this implementation plan would include the average cost of an additional piece of paper that would be added to the ABS, which is the discharge visit summary, and that would be about 4 cents, so very minimal cost. No additional work hours would be needed to complete the brief web-based module. A lot of nurses do their online learning modules during work hours. No additional expense to the Department of Nursing Education should be incurred, as all the knowledge should be pre-existing, and a short, concise, basic PowerPoint really should not be too time-consuming. There would be a cost to hospital systems to hire more dietitians and social workers. Dietitians, on average, in Connecticut make $72,445 per year, while social workers make, on average, $74,284 per year annually. So there would probably be an expense to hire at least another one of each, so that would be for the hospital systems to decide on. Training and teaching resources. So there would be a required annual web-based module for all nurses who work in roles with direct and patient contact. Inclusion with other web-based educational modules for new hires would kind of come in with new employees for these web-based modules. It would just be included in all their onboarding e-learning. And then some resources that would really help this change project would be collaboration with unit-based nurse educators. to facilitate constructive criticism for the module or to act as a resource for questions about content. So making sure the nursing education department does collaborate with unit-based educators will be really important to the success of improved education for nurses about obesity care. Evaluating effective change of the project. So we would implement pre-tests and post-tests with web-based modules to see if staff learned anything and how well they're competent to obesity care after taking the e-module. Patient satisfaction surveys, so trying to make sure that patients are giving feedback that they're getting all the resources they need while they're in the hospital. We could send surveys for nurses through work emails just to see how effective they think that the web-based education on obesity care is and maybe provide any feedback. And then the big kind of measure of how effective the change project would be is how the reduction in readmissions within 30 days of discharge are looking, months after this education was implemented for staff and they're therefore passed on to patients. So a pretty big reduction in readmission would be ideal and probably the biggest mark of success. Sustainment recommendations. So I do recommend an annual web-based training to retain this competency and emphasis on obesity care. The pre-test and post-test, like I had mentioned, with minimum score requirements, so maybe an 80 or higher, just to make sure that people are learning and they are becoming competent from these modules if they were not already. Trending feedback from patient satisfaction surveys, making sure that if they're not feeling that the resources they're needing are being met, then we're at least trying to tailor this process of our implementation for the change project. Keeping cost and workload low will allow for longer sustainment of the initiative, so just trying to keep the implementation plan very basic, very cost effective will allow for us to keep implementing and tailoring the implementation plan as needed. And eventually, a good sustainment recommendation is bridging from the inpatient to outpatient areas for this initiative. Hopefully, the goal would be not only to promote obesity care and, better overall health for inpatient patients, but also outpatient as well. So, key points of my project change. So the project change proposal is based off of needs identified in the Treat and Reduce Obesity Act of 2021. Obesity is the second leading cause of death in the US, so there really is a big need. Recent relevant research does identify gaps in patients qualifying for weight loss management, but not receiving weight loss education in primary care settings, so that really was the driving force for this change project initiative. Online learning is shown to have statistical improvement of knowledge levels among nurses, allowing for an enhanced ability to educate our patients on things like obesity care. So it is a really good, strong, data-supported substitute for in-person learning. And then just my biggest takeaway from this presentation, improved implementation of obesity care intervention paired with written and verbal nurse education will promote healthy lifestyles among patients and improve overall health status of our patients, which as nurses is our most important goal and really, what we strive to do. So these are my references, and thank you guys for listening. I appreciate it, and have a good day.